Picture this.
Yeah.
Your dog, who was just happily chasing a ball, suddenly can't catch their breath.
Yeah.
Or your cat, usually so agile, is now weak and maybe even collapses. It's a terrifying thought, isn't it?
It really is.
And today we're diving deep into a health issue you might not know much about. Hemothorax.
Yeah.
Basically, blood in the chest cavity.
That's right. Hemothorax is essentially the accumulation of blood in the pleural space. Think of that area between the lungs and the chest wall kind of filling up with blood.
Okay.
We're using the Veterinary Guide to Hemothorax as our main source today, really trying to unpack this pretty complex condition.
Right.
And what's striking is how something, like a bit of bleeding in this tight space can have such dramatic effects.
Exactly. So whether you're a dedicated pet owner, maybe you work with animals, or you're just, fascinated by how bodies work, this one's for you.
Mm-hmm.
We're going to explore what causes this, what the really crucial warning signs are, and how vets figure it out and treat it. We'll try to keep the heavy medical jargon down, too.
Good plan.
Okay, so what's the absolute most fundamental thing to understand about hemothorax? Like the starting point?
Well, at its core, it's just blood where it absolutely shouldn't be pooling in that pleural space.
Right.
And what's important to grasp is that this can happen really suddenly. We call that acute, often linked to an injury or maybe a problem with the blood's ability to clot properly.
Okay.
Or it can develop more gradually, over time. That's chronic. Think of it like a sudden big leak versus a sort of slow ongoing seepage.
So maybe like getting hit by a car versus
Yeah.
something, I don't know, developing internally over weeks.
Precisely. Exactly that. And while the problem is, located in the chest, it really has a domino effect. Hits two critical systems hard. The cardiovascular system, that's blood circulation, getting oxygen around.
Now the heart and vessels.
Right. And the respiratory system, our breathing mechanism.
Makes sense.
And what's also worth noting is that hemothorax doesn't really discriminate. It can affect dogs, cats, any age, any breed, male or female.
Okay, that's good to know. So what are those first red flags then? What kind of signs might make a pet owner think, hang on, something's wrong here? Maybe something like hemothorax?
Yeah, the symptoms can actually vary quite a bit. Depends on how quickly the blood's building up.
Okay.
But one key thing, and this is important, is that signs of low blood volume, what vets call hypovolemic shock, can sometimes appear before you see obvious breathing trouble.
Really? So even if they're not gasping for air yet?
Exactly. It's like the body's already struggling to get enough oxygen delivered, even if the lungs themselves seem okay at that exact moment.
Wow. Okay, so what else should we be watching for then?
Well, look for actual difficulty breathing, of course, that's a big one, but also just really rapid breathing, tachypnea.
Fast, shallow breaths.
Yeah. And the guide mentions something specific, a kind of honking cough in dogs that have eaten certain rodent poisons. That's a fascinating, quite specific clue.
Huh. A honking cough.
Mm-hmm. Other signs are things like unexplained bruising, especially around the neck and upper chest area, gums looking really pale, general weakness, lethargy.
Just not themselves.
Right, even fainting or collapsing. And if you could feel their pulse, it might feel weak, but paradoxically fast.
Those are definitely alarming signs. Are there things a vet might pick up during an exam? Physical clues?
Yes, definitely. During the physical exam, a vet might gently tap on the lower part of the chest, percussive.
Like listening to a drum?
Sort of, yeah. But instead of a drum sound, they might hear a dull thud. That's because the blood is acting like a fluid barrier, dampening the sound.
Okay.
But interestingly, if there's also air trapped in there that's called pneumothorax, right, then the upper part of the chest might sound unusually hollow, almost echoey. We call that hyperresonance.
Like dull down low, maybe hollow up high.
Exactly. It's about listening for those subtle, or sometimes not so subtle, differences in sound.
Okay, that really paints a clearer picture of what it might sound like. Now let's dig into the why. What are the main things that actually cause this? What leads to blood getting into that space?
Yeah, there are several main categories we think about. Trauma is a really significant one.
Makes sense.
Any kind of injury to the chest, car accident, a bad fall, even something penetrating like a bite wound or a sharp object, it can damage blood vessels. Vessels in the chest wall, in the mediastinum, that's the space between the lungs.
Right.
Or near the spine, even the heart, lungs, thymus gland, diaphragm, lots of possibilities.
So a big impact is a major trigger.
Absolutely. And it's interesting, even problems starting in the abdomen, like if the liver or spleen herniates through the diaphragm into the chest, that can indirectly cause bleeding too.
Wow. Okay, so trauma's one. What else?
Then there's neoplasia. That's the medical term for cancer.
Right, tumors.
Yeah. Tumors growing in or near that pleural cavity can basically erode into blood vessels and cause them to leak or rupture. Another really important category is coagulopathies, clotting disorders.
Problems with the blood itself.
Exactly. These can be inherited, present from birth, congenital,
Uh,
or they can be acquired later in life.
like the rat poison example.
Precisely. Poisoning with certain rodenticides is a very common acquired cause. But also liver failure can mess up clotting factor production.
Ah, the liver connection again.
Yeah. And there's even a sort of complex condition linking inflammation in the bile ducts cholangiohepatitis with disease in the small intestine, which can also lead to clotting problems. It's amazing how seemingly unrelated things can connect, isn't it?
It really is. Any other causes?
Yes, we can also see lung lobe torsion. That's where a section of the lung actually twists on itself.
Twists.
Yeah, cuts off its own blood supply, causes tissue death and bleeding. Then in younger animals, there's something called acute thymic hemorrhage, sudden bleeding from the thymus gland. And finally, believe it or not, certain parasites. Things like heartworm, Spirocerca lupi, Angiostrongylus viscerum. These have all been implicated in causing hemothorax sometimes.
Parasites too. Wow. It really highlights how many different paths can lead to the same critical problem.
It really does.
So it sounds like a real diagnostic challenge for a vet.
Mm-hmm.
How do they actually figure out it is hemothorax and not something else that looks similar? Must be like medical detective work.
You're absolutely right. It's often a process of elimination, what we call differential diagnosis.
Ruling things out.
Exactly. There are several other conditions that can cause similar signs, like breathing difficulty, for instance, just bruising of the lung tissue itself, pulmonary contusion, or just air in the chest, pneumothorax.
We mentioned that one.
Right. A diaphragmatic hernia, where abdominal organs slip into the chest. A flail chest, that's where broken ribs make a section of the chest wall move paradoxically.
That sounds bad.
It is. Then there are other types of fluid in the chest, not blood, like chylothorax, which is lymphatic fluid, or pyothorax, which is pus. Yeah. And even congestive heart failure can cause fluid buildup and breathing issues. So distinguishing hemothorax from all of those is step one.
So lab work and imaging must be absolutely crucial tools in this detective process.
Oh, completely. Standard lab tests, a CBC or complete blood count, a biochemistry panel, urinalysis, they're usually the first things run.
What do they tell you?
Well, the PCV, packed cell volume, and hemoglobin levels give an idea of blood loss. Though, interestingly, they might not drop immediately right after bleeding starts because the body shifts fluids around initially. But a low platelet count can be a big clue. Moderately low might just be from acute blood loss, but very low counts strongly suggest the body can't stop bleeding properly, like a primary clotting problem.
Right.
And actually looking at the blood smear under a microscope is super valuable, lets you see the platelets, estimate their numbers.
Okay, what about the biochemistry?
That can give clues about underlying causes. For example, low glucose, low BUN, low albumin, low cholesterol. Those might point towards liver failure being involved, which we know can affect clotting.
See, it all connects back.
It really does. Shows how interconnected everything is.
So what about analyzing the fluid itself, if they can get a sample from the chest?
Yes, that's thoracocentesis, or a chest tap. Analyzing that fluid is often critical.
How does that help?
Well, if the fluid is blood from a hemorrhage, its PCV and protein levels will be very similar to the blood circulating in the veins.
Okay, makes sense.
And you'll often actually see platelets under the microscope in that fluid sample. That really helps differentiate it from, say, fluid caused by inflammation or heart failure, which would have a much lower PCV.
Got it.
Now, with things like cancer or lung lobe torsion, the amount of blood in the fluid can be a bit more variable. And unfortunately, you can't always find cancer cells in the fluid, even if a tumor is the cause.
So it's not foolproof for cancer. What if they suspect a clotting disorder from the start?
Then specific coagulation tests are vital, things like ACT, PT, TTT. If those times are prolonged, it means the blood isn't clotting normally.
Right.
And if you see prolonged PT and PTT plus low platelets, that can point towards a really serious condition called DIC, disseminated intravascular coagulation, sort of like the clotting system going haywire.
Okay.
A test called D-dimer can help support that diagnosis too. To nail down specific inherited or acquired clotting problems, you might need even more specialized tests, like factor analysis.
Wow. Okay.
And there's one more test, the buccal mucosal bleeding time, BMBT. basically measures how long a tiny cut inside the lip takes to stop bleeding. It assesses platelet function and vessel wall issues.
That's a really comprehensive set of lab tests. What role does imaging play? X-rays, ultrasound?
Hugely important. Radiographs, x-rays of the chest are key. They can show the pleural effusion, the fluid buildup. Might just be a general haziness, or you might see distinct fluid lines where it's settled.
You can see the fluid level.
Sometimes, yeah, depending on positioning. But importantly, x-rays can also show associated problems, like are there rib fractures from trauma? Is there air in there too, pneumothorax? Signs of bleeding in the mediastinum, bruising within the lungs, issues with the diaphragm, even masses or tumors sometimes show up.
So that gives you the bigger picture.
Exactly. And there's a specific pattern-dense lung tissue with little air pockets that can sometimes suggest a lung lobe torsion.
Okay. And ultrasound, what does that add?
Ultrasound is fantastic for confirming there is fluid there. It's very sensitive for that. And it can be really helpful for visualizing things within the fluid, like masses or tumors, or spotting a torced lung lobe, or detecting those abdominal hernias we talked about.
So it sees things X-rays might miss.
Sometimes, yeah, especially soft tissue structures. And an interesting point, in stable patients without clotting problems, sometimes carefully draining some fluid off first.
The thoracocentesis again.
Right. Doing that can actually make ultrasound or even repeat x-rays clearer afterwards, like I'm clearing away the fog to see the landscape better.
So removing the fluid can be both diagnostic and potentially help with further diagnosis and maybe even feel better for the pet.
Potentially, yes. But big caution. If there is a known or highly suspected clotting problem, sticking a needle in there carries a risk of causing more bleeding. So vets are much more cautious in those cases.
Right, makes sense.
And sometimes, even with all the imaging and tests, the cause isn't clear, or they need to know which side the problem is on for surgery.
So surgery might be needed just to figure it out.
Occasionally, yes. Surgical exploration might be necessary for a definitive diagnosis. If imaging isn't clear on the side, often they'll explore the left side first, or use a midline incision, a median sternotomy to see both sides.
Okay.
And in these really complex cases, getting a CT scan before surgery can be incredibly valuable, gives a much more detailed 3D picture.
Okay, we've covered the whole detective work of diagnosis.
Yeah.
Now, the really crucial part, treatment. What are the immediate steps when a pet comes in with hemothorax? What's the priority?
Stabilizing the patient is absolutely priority number one. That usually starts with careful use of intravenous fluids.
5A fluids.
Yes. The goal is to support their blood pressure, try to get the systolic pressure above about 90 millimeters of mercury. That helps ensure enough blood flow gets to the vital organs. Different types of fluids might be used, crystalloids, colloids, maybe even hypertonic saline.
Okay. What if there's air in there too, the pneumothorax?
That needs addressing urgently as well. Usually by removing the air, either with a needle temporarily or, more likely, by placing a chest tube to allow continuous drainage.
And what about replacing the actual blood that's been lost?
Good question. Often, yes, transfusions are needed. That might be plasma, which has clotting factors, or specific concentrated clotting factors if we know what's missing, and definitely whole blood or packed red blood cells to boost oxygen carrying capacity.
Right.
If there's significant lung bruising, pulmonary contusion making it hard for them to oxygenate, they might even need temporary help from a ventilator.
Mechanical breathing support.
Exactly. And if the bleeding inside the chest is severe or just won't stop, then surgery becomes necessary to find the source and stop it.
Go in and fix the leak.
Essentially, yes. And throughout all this, providing supplemental oxygen is critical, and so is maintaining their body temperature. They can get cold easily when they're in shock.
Makes sense.
It's also worth remembering that in many clotting disorder cases, the main breathing issue might actually be from bleeding into the airway tissues, not just fluid around the lungs.
So draining the chest fluid might not fix the breathing.
Not always, no. And one other thing we sometimes consider is autotransfusion.
What's that?
It's where you collect the blood directly from the chest cavity and immediately give it back to the patient through an IV line, kind of recycling their own blood.
Wow, that's fascinating. When would you do that?
Specific situations, usually severe ongoing bleeding where getting donor blood is difficult or you need large volumes quickly. It has risks, but can be life-saving.
Okay. What about medications? Are there specific drugs just for hemothorax, or is it more about treating the shock and the underlying cause?
Yeah, it's mostly the latter. There isn't like a single pill for hemothorax itself. The treatment for the shock, the low blood pressure, is mainly the fluid therapy we discussed.
Right.
But for specific causes, yes, there are targeted meds, like the rodenticide poisoning example.
Vitamin K.
Exactly. Vitamin K1 therapy is absolutely essential. Usually starts with a higher dose injection under the skin,
Subcutaneous.
right, with a small needle, then followed by oral doses, usually twice a day, for quite a while, often 3 to 4 weeks.
That long.
Yes, because those poisons linger. And importantly, vitamin K1 doesn't work instantly. It takes, at least 12 hours, maybe more, for the body to start making effective clotting factors again.
Good to know it's not an instant fix. What else? Pain relief.
Oh, absolutely critical, especially with trauma. That might be systemic pain meds or even local nerve blocks to numb the area. And if there's a risk of infection or if surgery was done, broad-spectrum antibiotics would likely be used.
Okay. Are there any medications that should absolutely be avoided?
Yes, definitely. Anything that can interfere with blood clotting is generally a no-go. So things like aspirin and other NSAIDs, non-steroidal anti-inflammatory drugs, they could potentially make the bleeding worse.
Right. Avoid those.
Yeah.
So once the pet is through the initial crisis, what does the follow-up care look like? How are they monitored?
Careful, consistent monitoring is key. Really close tracking of their clinical signs. How are they acting? Are they bright, lethargic? Checking their breathing rate and effort constantly. Heart rate, temperature, are they producing urine okay, and assessing their pain level.
Keeping a close eye on everything.
Everything. Follow-up chest x-rays are usually done maybe every 48 hours or so until things look stable, just to make sure fluid isn't building back up or other problems aren't developing. And if it was a clotting disorder, repeat coagulation tests are needed at specific intervals. For rodenticide cases, that usually includes testing again about 48 hours after stopping the vitamin K, just to be sure the body's clotting is truly back to normal on its own.
Makes sense. Double checking. And what are the potential bumps in the road? Complications that can happen even after treatment starts?
Yeah, unfortunately, complications are possible even with the best care. One risk is infection developing in the chest cavity, that's pyothorax.
What's in the chest?
Right. Or a more widespread infection throughout the body, sepsis. That's very serious. And sometimes long-term, there can be scarring or fibrosis within the chest cavity that can sort of trap the lungs and restrict how well they can expand. Lung entrapment.
Well, so lasting damage is possible.
It is, unfortunately, in some cases.
Well, this has been an incredibly informative deep dive into hemothorax. Really detailed. To kind of bring it all together, what are the most crucial points you'd want our listeners to take away from this?
I think the key things are hemothorax, blood in the chest, is serious, potentially life-threatening in pets.
Definitely.
It has this really wide range of possible causes, trauma, yes, but also cancer, hidden clotting problems, even parasites sometimes.
So many possibilities.
Exactly, which means getting an accurate diagnosis quickly is absolutely critical. That often involves that combination of lab tests and imaging we talked about.
Yeah, detective work.
Right. And finally, treatment really needs to be tailored. It depends on the animal, the underlying cause. But that initial focus is always on stabilization fluids, oxygen, maybe transfusions, recognizing those early signs we discussed that can truly make a huge difference in the outcome.
Absolutely.
Yeah.
Well, you've definitely gained a much deeper understanding of this pretty serious veterinary emergency now, and we hope this knowledge is valuable, whether you're a pet owner or just, fascinated by animal health. And here's maybe something interesting to think about. When you consider that huge diversity of causes, right? From a simple, forceful impact to the incredibly delicate balance of blood clotting or even tiny parasites.
Oh,
it makes you wonder, doesn't it?
Wonder what?
What does finding blood in that normally air-filled space really tell us about how incredibly intricate and interconnected a living body is? How messing up one system, even slightly, can have these massive ripple effects.
That's a great point.
This complexity, I think, it just really underscores the vital and often really challenging role of that thorough investigation, that critical thinking in veterinary medicine, trying to piece it all together.
Absolutely. It's rarely simple.